can hear me okay. Good. All right. Well, thank you. So we are reporting today, the release it's been sent out that there's 4 cases of the UK variant identified in Brazos County. This was in 2 males, 2 females, ranging from 19 to 64 years of age, all white, non-Hispanic members of the community. This is 2 in Bryan, 2 in College Station. The dates of the positive test range from January 27th through February 7th and have all been confirmed since then. Travel history: 3 did not have any travel history. 1 had travel history, but only in Texas. And 2 were exposed to COVID-19 patients previously. Of the cases, there were 6 identified contacts, all who have tested negative, and all had mild illness ranging from a few days up to 16 days of illness, but no hospitalizations required or severe illness thereafter, and no deaths. I'll just add, this wasn't in the release, but to date, I just looked up that in the United States, 1,881 cases, according to the CDC, of this UK variant had been reported and verified. In the state of Texas is at 60 cases. And so this would be 4 of those probably added to that number. So I am available for any questions about the variant or anything else that's on your minds.
Okay, so we will start with La Voz Hispana. Oh. You're on. There we go.
Okay. Hi. Okay. Just one question. We've been through a lot of stress during these days. Sorry about that phone. So I don't know if we need to treat this like a special way or so, because, like with all the COVID plus the storm plus everything, we've been through a lot of stress. Do we need to make this like a big deal, or just keep it like the way we've been keeping it?
Yeah, this is not a surprise. As a matter of fact, I'm surprised we haven't seen this sooner, and we expect this. Variants are a part of viral transmission. We expect to see variants. We're going to see more variants. The really good news here is that this variant, which has been tested, there's been studies that have looked at how effective the vaccine is, especially the Moderna and the Pfizer vaccines, the first released, do against this variant. And we have a great degree of confidence that this vaccine is effective against these variants. It's important, the longer this goes on, the more variations of the virus we're going to have, the more it's going to evolve from its original structure. And so I think the message here is that we need to maintain our efforts of the social distancing, the mask wearing, and the fundamentals of the COVID-19 response. And then also this vaccine is just important. It's important that we get it out. And certainly here locally, we've been doing everything we can. Really tip our hat to Chief Stewart, who's done a great job of organizing the effort to deliver as many vaccines as are available. The challenge is getting these vaccines here, and everywhere, of course, is having that struggle. But that's going to improve. And as that improves, we'll get this vaccine out. There's been a wonderful demand for the vaccine, and that's great. It's great that many people want it. And so we need to get it out. We need to deliver that vaccine. And so I think the message here really is that we need to stick with the fundamentals, stick with doing what we're doing. When our time for our vaccine is available, that we go and get it, and that we really expect this to happen.
Thank you.
Thank you.
Okay, and KAGS.
Hey there, Dr. Sullivan.
Hey Tristan, how you doing?
Not too bad. How about yourself?
Good, thanks.
So my question kind of goes off of that. Just how do mutations play a role in effectiveness of vaccinations?
Well, they definitely play a role. What these viruses do is that they have mutations in their nucleic material that then produces different proteins. And it's these proteins that the virus uses to attach to our cells. And it's also those proteins that our bodies used to recognize the virus. And so these proteins, the structure of these proteins is very important. And the further we get down the line, the more mutation there is, the least recognizable it becomes, might be the way of thinking about it, to our immune system. And to the immune system, by the way, that we're eliciting with the vaccine. So the vaccine is a way to to introduce this protein structure to the body. And the way that we're doing that is with this RNA, the first, the Moderna and the Pfizer vaccines that have come out. And that was based on the structure of the spike protein that we know of and that we had seen. And so it is variations in the spike protein that we need to be very careful moving forward to know about. And so, it's something that we're going to have to continue to have good surveillance to do this. And so that we're looking for it is key. And that's occurring. That's occurring worldwide. And but the further we get down, and that's why I think that if we had to say what's going to happen in the long term here, I think that there's going to be variations that will even move beyond our current vaccines. Maybe this is a year or 2 or 3 down the road, and so I suspect that we'll need boosters for this down the road, and that a version of coronavirus is going to continue to circulate year round in some form or fashion. I don't expect it to look anything like it's looked this past year, but we do expect variations to continue to occur.
Thank you.
Mm-hmm.
All right, and KRHD, Jonathan.
Hey, Dr. Sullivan.
Yeah. Hey, Jonathan.
Yeah, my question is just for the individuals that have contracted and may contract the this UK variant. Is there anything like, if they are asymptomatic, is there anything that they need to do as far as like quarantining, or like will they be able to like take a if they take a COVID test and test negative? Does that mean they're clear of this UK variant?
Yeah, the recommendations for isolation after infection are the same for those who have this variant, and so all the public health guidance is the same. Yeah, so if they do test negative, then they would have cleared that. But interestingly, Jonathan, we saw even the original strain, if you will, of this, that folks would continue to test positive of this. And one of the things that we're learning more about is not just being able to say this is positive, this is negative, but how positive is it? And this is a correlate of the viral load, or how much virus there is. And this is in PCR world, it's the cycle threshold. It's how quickly it shows up positive. You think about it, the more quickly it shows up, there's more of it there. And so this is part of what we're learning. We're trying to determine ways that we can quantify that better, to try to determine contagiousness and determine infectivity. And so right now we have a test, it's positive, it's negative. And so we need to maintain those, the guidelines as they've been written for those in isolation.
Thank you.
Mm-hmm. You're welcome.
All right, and the Eagle.
Hey, Dr. Sullivan, how's it going?
Hey, Alex, doing all right. How you doing?
I'm doing pretty well. Hey, I guess kind of my question, after all we've been through the last 11 months, maybe what's your message to some folks who might be feeling anxious hearing this new news about something that's COVID related?
Yeah, it has been a tough year, Alex. And what I would say is to hang in there. I really do believe that the summer is going to look different.
Local.
We're going to have
Trusted.
a lot more vaccine available.
This is First News at 4 on
With
KBTX
that
News
vaccine,
3.
we'll be able to make a dent. And so we have some, we have some more work to do, for sure. But this variant is, I don't think any virologist out there is surprised to see it. And so, as variants arise, and, just yesterday I saw that, in California, there's a couple others that are circulating. And so we're going to see these variations, and it doesn't change our strategy. It doesn't change what we need to be doing. And the the basics remain the same, the way that this virus is transmitted. And that, I think, is the message here. This isn't, this isn't the kind of March of 2020 kind of stuff here where we're looking back to saying we're starting all over again. I don't think any of us see that. The work that we've done so far is work. And what I mean by that is that our bodies that have seen the original virus, if you will recognize parts of the variant as well. And so there's going to be some cross protection there. And even if it's not perfect, as it is with the vaccines as well, we do believe there's going to be some cross protection. So that we've talked a lot about herd immunity. When do we get to that herd immunity of individuals who have naturally acquired the virus and those who have been vaccinated? And when is that total number high enough that we won't see widely circulating virus? And that work is still ongoing. And this doesn't reset the clock by any means. And we're not going back and starting over. I mean, all the work that we put in is for good. So I remain optimistic. We have work to do. We've got to get folks vaccinated, and that's been a challenge. There's new vaccines being approved, and so and we're learning how to do this more efficiently, more effectively, how to get large numbers of individuals vaccinated as well. And this is a new challenge for us. Such a large demand for vaccination. So a lot of good news as well. And this, I would really say, is expected news more than it's bad news.
Thank you, Dr. Sullivan.
You're welcome, Alex.
Okay, and KBTX.
Hi, I think I'm okay. Thank you, though.
Good. All right. Well, I appreciate y'all. Thanks for spreading the word on this release.
Thank you so much, Dr. Sullivan. I appreciate it.
All right. You're welcome.
Thank you.
Thank y'all for joining us, and I will send out the recording in a little bit.
Thank you.
Okay.
Thanks for coordinating, Sarah.
Yeah.
Thank you.
Of course. Okay. Bye-bye.